We wanted to, first of all, we're bringing together, Mayor Turner, as you'll see, Dr. Peirce, City of Houston, Dr. Shar, Public Health Department Head, Dr. Plasencia, who's with the State Health Services, and Dr. Minter with Fort Bend County Public Health. We have received confirmation this afternoon of the first 2 confirmed cases of coronavirus in Harris County. That is a man and woman who are both, along with the Fort Bend case that was confirmed yesterday, these folks were all part of a trip to Egypt. They are part of a larger group that we're aware of that are now under self-quarantine and have been under self-quarantine and are being tested. The man and woman are both in the hospital in stable conditions. What I want to clarify is we've been treating all of the folks associated with this trip as presumptive positives in a way. We have been asking them to self-quarantine. We have been mapping their networks, where they've been, and reaching out to the folks they may have come into contact with to make sure that we are still containing the spread of this. This is just the first 2 cases. We expect to see more in the coming days as we receive test results back. But know that we are very much in the containment phase. I will note as well the patient, one of the 2 folks who were confirmed positive today, is a Rice University employee, and there will be a statement, I know, from the university coming out later today. As far as what we're doing differently now that we know we have these 2 confirmed cases, we'd been treating them, as I mentioned, as though they were already positives and reacting to doing the mapping work appropriately. We are speeding up our reporting period and all of our systems here at the Office of Emergency Management. As you all know, we activated on Monday formally to level 3. We've been running exercises and updating our plans for weeks now. And we are now growing the number of folks that will be at the Emergency Operations Center every day. We will be continuing to work very closely with our hospital system, very closely with all our partners, from the City of Houston to the school districts to all the folks that make sure that our community runs well, so that we can all prepare for whatever might come next. But it's important to recognize that the real next level of concern is if we were to start seeing cases that we can't trace back. Both of these cases and the case that was identified last night in Fort Bend County, they're all travel-related cases. So none of these are, unexplainable. There is no community contagion. There is no indication that they may have contracted this even on U.S. soil. So that's good news for us, because we have a close loop of people right now that we've identified, that we're following up with, that we're informing they may be exposed, and we're continually trying to identify if there's anybody else. So it's a containment phase still that we're on. Every resident in Harris County, in our region, is ultimately part of our public health team. We all have to do our part. And our part right now continues to be to wash our hands, to not sneeze or cough into our hands, to stay home from work or school if we feel sick, and to continue to pay attention to the news. We are governed right now by transparency. All the information we're sharing with you guys is the information we have confirmed. We will not be providing information that we have not confirmed with the Centers for Disease Control, but everything we know for a fact to be true, we are sharing with you, because we want to make sure that the community is informed. As we receive any more positive cases, we will share that with the community. If we get to a point in which we are seeing cases that are not traced back to particular travel, to particular reasons for these people to be infected, we'll share that with the community as well, and that will indicate a new phase in our response. But right now, we're in the containment phase. We need to all continue to be vigilant. The city, the county, Fort Bend, and other counties, all of our health departments are working very closely together across departments, also within each of our entities, and with the healthcare systems to make sure that we're responding and that we're prepared for if this issue were to grow, if we were to see more people affected. We are working through all of those contingencies. What would we do if we saw a significant number of people affected? How many tests do we need to be able to have in order to do that? What about folks who are affected who need to be quarantined but are breadwinners? We're asking all of those questions. What about public transit? All of that we're discussing, we're rehearsing, and we're trying to prepare as best we can. I'm going to repeat my remarks in Spanish. Then I will welcome Dr. Shaw to speak and share from his public health standpoint. Then the mayor will speak, and finally Dr. Peirce with the City of Houston. En español, entonces, estamos aquí presentando que esta tarde hemos confirmado los primeros 2 casos del coronavirus en el condado Harris. Son una mujer y un hombre. Ambos han viajado con el caso que se identificó anoche en el condado de Fort Bend. Los 3 fueron parte de un viaje a Egipto, donde entendemos se contagiaron con el virus. Entonces, hay más personas que fueron parte de este viaje, todas las hemos identificado hasta donde hemos podido y hemos venido hablando con ellos por los últimos días, antes de siquiera haber recibido un caso positivo, para entender dónde han estado ellos, con quién han tenido contacto y monitorear todos esos contactos, mandar más exámenes donde fuera necesario. Tanto la mujer como el hombre están en situación estable, en condición estable, en el hospital en este momento. La mujer, ella trabaja para la Universidad de Rice y sé que la universidad va a estar ofreciendo más información ahora más tarde. Fuera de eso, pues, ¿qué estamos haciendo aquí en el condado diferente? Lo más importante que saber es que desde antes de recibir estos exámenes positivos, estos resultados positivos, hemos venido tratando a estas personas como si hubieran sido ya diagnosticados, hubieran ya recibido un diagnóstico positivo. Entonces, continuaremos haciendo eso. Estamos acelerando los ciclos de trabajo aquí en la Oficina de Manejo de Emergencia, invitando más socios a que trabajen aquí día a día, todos pues coordinando con la ciudad, con otros condados, con otras agencias y distintas agencias dentro del condado Harris para prepararnos. ¿Qué haríamos si viéramos muchos más casos? ¿Cuántos exámenes debe tener nuestra región para poder, si hubiera pues un crecimiento en el número de casos? Si tuviéramos que manejar algo en el sistema de transporte público. Nos estamos haciendo muchas preguntas si esto fuera a seguir creciendo. Lo bueno es que en este momento seguimos en una fase de contenimiento. Hemos podido contener estos 3 casos. Todos son entendemos cómo fueron contagiadas estas personas. Todas 3 fueron un viaje. Esperamos que lleguen más casos positivos, ya que más gente participó en este viaje, pero no ha habido ningún caso que sea una transmisión local. Ninguno de estas personas se ha contagiado, ni siquiera en los Estados Unidos. Ahora, lo que debemos todos recordar es que al final del día, cada residente del condado Harris es miembro de nuestra comunidad de salud pública, de nuestro esfuerzo de proteger la salud de todos. Entonces, lo que cada residente debe seguir haciendo es permanecer en casa, no ir a trabajo, no ir a la escuela si se sienten enfermos, no toser en las manos, lavarse las manos, estar muy pendientes a los medios, las noticias. Siempre en readyharris.org estaremos poniendo información. Nosotros estamos haciendo todo lo posible por predecir qué pueda suceder a futuro. En este momento, como dije, es una una situación que no se ha expandido fuera de una red que ya tenemos mapeada, ya tenemos todas las personas identificadas hasta donde hemos podido identificarlas. Entonces es una fase que no es tan preocupante como si tuviéramos casos que no podemos explicar. Si viéramos contagio dentro de la comunidad, eso sería más preocupante, pero en este momento no estamos allí y seguiremos trabajando todos los días por coordinar de la mejor manera posible. Finalmente, la información que recibimos nosotros va directamente a la comunidad. Toda la información que podemos confirmar con los Centers for Disease Control, al gobierno federal, toda esa información la estamos corroborando y comunicando a la comunidad. A medida que recibamos más casos positivos, lo comunicaremos. Si escuchamos que hubo una transmisión dentro de la comunidad, ustedes lo sabrán. Realmente la transparencia es muy importante para nosotros y solamente queremos asegurarnos que cualquier cosa que digamos sea completamente cierta, que no estemos compartiendo ningún rumor. Entonces, ahora daré la oportunidad a Dr. Shah, quien dirige el Departamento de Salud Pública, que también nos dé su reporte. Dr. Shah.
Thank you, Judge. Thank you, Judge Hidalgo, for providing this important information to our communities. My name is Dr. Umair Shah. I'm the Executive Director, Harris County Public Health and the Local Health Authority for Harris County, and I'm pleased to join Mayor Turner here and certainly our colleagues in public health. And I think Judge Hidalgo has provided all of the information that is really important for our community to know. Let me just reemphasize a few points here. First and foremost is that we are aware and have been investigating, along with our regional public health partners, individuals who went on a trip to Egypt, and based on that travel exposure that occurred overseas, not here in Harris County or our region. Let me make sure that's clear, that the travel exposure was overseas and not here in Harris County. Out of additional investigative steps, we were able to determine that there was a link between the individual who was confirmed yesterday evening by Dr. Minter at Fort Bend County Department of Health and Human Services, and she's here, as well as the two cases that we are confirming today. The two cases that we're confirming today are individuals, as the judge mentioned, who are hospitalized, a man and a woman. They live in the northwest part of Harris County, in the unincorporated area outside of the city of Houston. These two individuals are in stable condition at a local hospital, which is good news, and we want to continue for that to happen. Right now, our main goal is to ensure that our epidemiologists and our public health team, working not just at Harris County Public Health, but across the region, including Fort Bend County and our City of Houston partners with Dr. Peirce and his team, that we do everything we can to determine who else may have potentially been exposed to these individuals. That's our number one priority. As the judge mentioned, we have no evidence of community-wide spread at this time. However, what we do want our community to know is that, as we over time have said, that this is a concern that we have of what's happening globally, what's happening then domestically, especially on the West Coast, that eventually there was the potential that something would get confirmed here locally, and that is what's happening today. So I want to just reiterate that our message to the community at large is we want our community to continue to do all the things that they continue to do. They need to help us protect our community by covering their cough, making sure they wash their hands with soap and water, use hand sanitizer, and most importantly, if they are sick, not to go to work or school or to expose others. That is absolutely critical so that our community can help all of us, all the public health folks and all the regional partners do our job in order not just to investigate what's happening here, but also to make sure that our community remains protected and safe. The final thing I want to say is that this is obviously concerning to some individuals. When individuals hear this information, they may say, what does this mean to me? We want to emphasize that what this means to you is for you to be mindful that there are respiratory diseases out there, and we want you to do all the things that you can do to protect yourselves and certainly protect your families and those around you. Because these two individuals remain hospitalized, these two individuals are not in the community, and so these two individuals are not obviously exposing other people outside of where they are right now. And so with that, let me turn it over to Mayor.
Thank you, Dr. Shaw and Judge. It's good to be with you, and let me be very, very, very brief. One of the things that we wanted to make sure is that when we receive information, we wanted to make you available. What is the common denominator between the case in Fort Bend and the two cases here today in Harris County is that they were all on the same trip together in international travel. Those are the common denominators that exist, and I want to underscore that. Having said that, what I also want to say is that I'm hoping that and encouraging people to minimize, for now, their international travel. Not telling you not to. I just hope you will minimize the international travel, because for right now, for us, that's the common denominator, and we're trying to minimize the risk to all people in Houston, Harris County, Fort Bend, and people in the region. And that's one of the reasons, for example, that we decided to cancel several weeks and put it off for next year. The other thing that I would say is that we have the ability now, City of Houston, to test, and so we can do that now in 24 hours instead of sending samples to the CDC and having to wait 48 to 72 hours. So that's a big plus for us, that we have the ability to test right now in the City of Houston. The good news, in addition to that, is that other hospitals in the City of Houston are working to get up to the capability so that they can test themselves as well. And I've had the opportunity to talk to some of the doctors in the medical center, and they're looking to be able to do that. And that people are planning. We said from the very beginning we would plan for the worst and hope for the best. And so the planning has been taking place with the county, with all of the counties in the region, with our medical institutions over the last several months. This would be an excellent time again to engage in staycations. And let me say that, instead of people leaving the country and then coming back, especially with spring break coming up, instead of people going some other place outside of the United States, an excellent time to engage in staycations. Stay home, and take advantage of all of the attractions and the things that exist within Houston, Harris County, Fort Bend, the surrounding region. Certainly would encourage that, and we've encouraged our hotels, for example, to offer special discounts in the month of March, and they are doing just that. Let me also encourage our businesses, corporations, senior living facilities, nursing homes, schools, educational facilities, to have their own preparedness plan in place. That would be very, very helpful. And so instead of just waiting for there to be an expanded number of cases, right now companies, schools, universities, senior living facilities ought to have their preparedness plan in place. I'm not going to repeat all the other things you've heard about proper hygiene. I'm not going to go over all of that. But what I will say is that we are carefully monitoring all of the situations. We're working very closely with one another. We don't want to become paralyzed by our fear. So I'm still encouraging people to go about their business, but to be very exercise common sense and good judgment, but to go about your business. Just like 50 of my executive team members went with me to Asia Town and had lunch today. Great meal, good meal, and we are moving forward. And so, but what we wanted to do is to make sure that when when cases are positive, that we provide you that information in a timely fashion, that we provide you with information that we have, because information is important, and we want people to know that we are doing everything within our power to make sure that we're keeping people safe in Houston, Harris County, Fort Bend, and the surrounding region. Doctor.
Quick question. So folks that arrived,
One-
presumably by name.
One second, please, 1 second. Dr. Purse, and then after Dr.
And then
Purse.
we'll take questions. We're going to speak, and then we're going to take questions. So let's hear from Dr. Purse. Yeah.
Dr. Purse.
Thank you. So I just want to reinforce a couple of things. Most everything of importance has already been said, but a couple of things I just want to put into perspective for people. So we live in Houston, Texas. We live in Southeast Texas. So one of the things that makes this community unique, in my experience, I've lived in New York, I've lived in California, I've lived in D.C., I've lived in a couple of other places. But one thing about this community that's unique that we need to pay attention to is that we have a very robust medical community here. Very lean, is the world's largest medical center, some of the brightest minds. We also have, because of our weather, we have faced disasters, weather disasters generally, that have taxed our healthcare system. And so we have a very tight relationship with the healthcare institutions in the community. And so while we are hoping for a mild impact from this virus, we are preparing like every other major metropolitan area across the United States is, but we have the added advantage of having gone through similar drills, if you will, with hurricanes and flooding that have stressed our healthcare system, and we've got a very good working relationship, first name basis in many cases. Mayor Turner met with the CEO from the Texas Medical Center, and Dr. Shaw was there as well, and we met with the leaders of the major healthcare institutions several weeks ago, and so we've been coordinating with them for weeks. And so I think that people need to listen to what has already been said, and I would ask you to think of it in two ways. There's some things that we can do, and that we are doing those things, and we're doing them quite diligently and spending a lot of hours in anticipation, but there are also things that the public can do. And I want to remind you, I've said this a couple of times, but when we look at the other epidemics that we've had in the last couple of decades, they have ultimately been stopped because of a great coordination between the government and the people in the populace, and the people followed the advice, and that's how SARS and MERS and even Ebola, that's how they were stopped. And so as a community, not just the government, but as a community, a whole community, we are incredibly powerful and incredibly capable of having a huge positive impact on what faces us from this virus. And so with that, I'd say thank you.
Yes, questions.
I appreciate it. So the question is, they returned home these patients, obviously via some airline, and presumably with other Houston area residents. Have those residents been notified? Have you identified the airline? What are you doing on that end?
Yes, so not only the trip back, but also, you know, where they've gone about their day before they knew, before their doctor said, hey, wait a minute, you may have coronavirus. As soon as they knew and we knew, our epidemiology team reached out to them and have been, you know, making sure that they're self-quarantining. But of course, by then they had some contacts. So that is the work that Dr. Shah's team has been doing, deep investigative work to identify all of the leads of people that we may need to give a heads up to, or even ask them to self-quarantine. So let me just make that clear, that even before this result came back positive, we have been going back up the pipeline and trying to map and trying to address what really happened. Of course, it's not easy, right? It takes a lot of work, but you have full teams of professionals who do this for, all kinds of diseases, working on this for you. So Dr. Shah can fill you all in on exactly what that looks like.
Just to be clear, can you say assuredly that the people who were on that airline with these folks have been notified?
So thanks for that question. So I think what we have to just remember, as the judge said, is that we work as part of a system. So it's not just the local health department. It's working with our regional state health department. Dr. Carlos Plasencia is here, and working with our state government as well as the Centers for Disease Control and Prevention. And so what we're doing right now is continuing the investigation on individuals who may have been in contact with. I think it's important to remember, it's really important to remember that symptoms started well later, not early in the process. So I think your question implies when somebody may have initially walked off a flight, that individual may have had some symptoms or may have been now exposing someone else. And the truth is that our investigation is revealing that it was actually later in the process. So we feel comfortable right now, again, not fully confirmed because we're working again back through our federal partners. We feel comfortable that we have the right individuals. There may be more that grow in this number, but the right individuals that we have to continue to monitor and contact and assure that they are not additional cases for novel coronavirus.
I don't mean to press, but regarding the airline question specifically, have the people on the flight that came back with them, people who are Houston or Houston Houston area residents been notified?
We're working with our federal partner, the Centers for Disease Control and Prevention, as you can imagine, to assure that anybody who may be at risk from the potential confirmation of a case, which, by the way, just so we can make this clear, the testing was sent earlier this week, and we received the results just back this afternoon. So we are part of that process of determining if there are anybody else that we need to be worried about. That is what the investigation is about. And honestly, our epidemiologists do this a lot. They do this for tuberculosis. They do this for a number of other infectious diseases. This is their bread and butter. This is what they're good at, and this is why they have to get their ability to get that investigation done in the right manner, and that's what they're doing.
Do you know how many people are you identified?
Right. So we're not able to provide details of the investigation in terms of how many people, but we are going to say, and it's important for us to say, that the individuals that we have identified related to these two individuals who have been confirmed today, obviously with Dr. Minter, with the individual that was confirmed yesterday, that we are in the process of doing all of the contact tracing, identifying all the contacts, identifying any point in time where individuals, these three individuals went from being not symptomatic to actually having symptoms, and from that moving forward with determining who those individuals are and making contact with them.
Do we know exactly do we know if one of these individuals you mentioned is an employee in Rice University? We're talking about almost 7,000 students there. Do we know if he went back to work and he was around anyone that, he went back to work without any symptoms?
Well, we don't. So let me make sure I address the Rice University piece, and the judge obviously has said this a bit earlier. And I think it's important to remember that Rice University, as soon as Rice University came to learn of a potential situation with one of their staff members, they took the appropriate steps, which were to assure that individual was self-quarantined or home quarantined. And so now our job in public health is to work with our partners at Rice University to make sure that we determine anybody else who was in contact with that individual who are self-quarantined, that they don't develop symptoms. And so that's what we're doing right now.
What are the ages of the latest patients?
The age range is between the age range for the individuals that were confirmed today are between the ages of 60 and 70. And remember, there's a man and a woman, and they live in the northwest part of Harris County in the unincorporated area.
Do you know how many other people may have been on this junket or from this area?
So there were multiple people that were on this trip, and we're doing our best to determine all the individuals that were on that trip. But I'll tell you very honestly, we do not release the information. I think we have said this multiple times. We said it earlier today, that we do not confirm rumors. We confirm cases. And so, yeah, and I was just going to say that, so from that standpoint, we know there are multiple individuals that were on that trip, obviously. There is a link to that trip. They were exposed overseas on that trip, and now we're doing the investigation, Judge.
When did the flight come back? When did they return?
It was in late February.
Do you have an exact date?
I cannot give you any further details.
And
Is there a reason why you guys can't tell us?
Well, the reason that let me explain that, because what we don't want to do is to create some additional concern in the community, the flying community, people who may have traveled. I traveled in February as well, right? We don't want to create that kind of angst or concern. What we want people to know is that individuals who have been in contact with these two individuals are being contacted and being investigated, and they're also being monitored so we can determine whether they have symptoms and whether they need to be tested for novel coronavirus.
And let me just, obviously the idea or the goal with everything we're doing is to ensure that we're sharing facts instead of spreading fear. And it's very natural and understandable that folks immediately jump, to the worst case scenario. So that's our job, is to think about that. For example, when you think about the numbers of people who went on the trip, that was a question that came up. We've gotten different answers from some of of the interviews we're doing. So until we have a verified answer from the Centers of Disease Control, we can't share a number that we're then going to end up having to correct. So that is really, where we're drawing the line. Is let's make sure we're certain in terms of, be it the flight or the contacts at the university, they're looking very closely, and I'm asking this question of our public health team every day, is are we going as far as we possibly can to ensure that, to the best of our knowledge and according to the science, we are tracking folks that should be aware of this. And the initial conversation was, in some jurisdictions, they will only contact those folks once the case has been diagnosed. But we said, no, even if it hasn't come back positive, let's assume that it is positive, and let's treat it that way. And so that's where, if they know that folks aren't contagious until a certain point, they're not going to go and scare everybody else who really couldn't have gotten it. They're doing according to their science and their knowledge and the best practices as accepted internationally and nationally, contacting the folks that need to be contacting. Right now, we need to remember that we are in a containment phase. It's not the time for folks to be panicked. If we have news of that contagion locally, we'll address that then. But the work that's being done right now is the mapping and the follow-up, and the folks at Rice that have been identified are all self-quarantine. Rice has done a great job with that, and the teams at the City of Houston, Public Health, Fort Bend, the state, and even the federal levels are figuring out, okay, of all those folks, who needs to be tested. Obviously, the tests right now are taking more time, so they have to prioritize, and then it's great news that we're able to do the tests locally as well.
And if I can just add, what should be highlighted is that all of the people of concern have been monitored and have been self-quarantined. So everyone that's in the area that is of concern or was on this trip have been monitored and self-quarantined. And then, of course, you have 3 individuals now, the one in Fort Bend and the 2 that lived in Northwest Houston, who are in the hospital. So we are following the proper protocols in this matter.
Is the case CDC confirmed now? Who we have not heard back.
What did you guys?
So the specimen has to get mailed to the CDC. They have to ship the specimen, and then the CDC runs the test. The test was run in the Houston lab yesterday. We have not yet heard back from the CDC.
How come we can provide a specific age for the Fort Bend County patient, but not the patients that are here in Harris County?
Is there a specific age?
We do Harris County Public Health whenever we've had previous instances, whether it's Zika or instances where we're identifying other kinds of infectious disease related activity. We actually give a age range, and we give a quadrant over a county, and that's the way we have been reporting it. Fort Bend does it a little bit differently, but that's the way we've been reporting it.
Is it the male or female patient who is a Rice University employee?
It's the female.
Yeah, it's a woman.
And again, can you say, has she been back to campus? Rice put out the self-quarantine note over the weekend. Has she been back to campus since the trip you on that?
I can't give you all the details at this time. We're still going through all the information and the investigation, but I will tell you that both individuals are hospitalized at this time.
Thank you, guys.
Yeah. Thank you so much. Yeah, appreciate it. Yeah. Oh, yeah, that's right. Yeah. All right. Thank you. Yeah, thank you. Yeah.
Yeah.